So ketamine is a chemical that was synthesized about 70, 60 years ago. It was originally an anesthetic, and then they used it as a tranquilizer. Eventually it became in the 90s, it became a street drug, and then we use it in psychiatry as a very powerful antidepressant. So we use it for anxiety, trauma, depression, and then we also use it as a psychedelic to have spiritual experiences or awakening experiences. So AUD is alcohol use disorder. Very, very tough issue to crack. In fact, it's so notoriously tough that they came up with their own program, and that's the 12-step programs. But because of the nature of addiction, because it kind of takes over your brain, we've struggled in psychiatry to find treatments specifically for alcohol use disorder. But in the last 20 years, actually, some of this research is from early 2000s. They've seen some pretty amazing results with ketamine therapy, and alcohol use disorder. So for instance, there's a study where they compared one session of ketamine versus just standard treatment, which would be like 12-step programs or talking with a therapist. And it tends to be about 3 times as powerful as those treatments. So what that means is days sober, you would have 3 times the amount of days sober as compared to regular treatment. So that's pretty incredible. It also tends to help people have what I would call secular spiritual experiences. So they might have realizations about trauma that they've experienced, and they're able to take that and run with it. Ketamine also changes the brain pretty quickly. It increases a hormone called BDNF, which makes your brain just very, very changeable. It allows for neurogenesis, which is the creation of new neurons, and for neurons to connect more rapidly to other neurons. So all of that basically means that you're able to make new neural pathways and new habits much, much quicker. So if you have the alcohol use disorder very ingrained in your brain, you can use ketamine as a tool to break out of that and to create new habits. So that's always an interesting one, because addiction is not binary. Addiction is a spectrum, right? And everyone is on the spectrum. From I could do a shot of heroin and then just put it down and never feel a desire to do it again, all the way to the type of person that they will do literally anything to get high. They will get addicted to anything. So I think that from the research that I've seen, it allows for longer times of abstinence. It allows for less days binge drinking, and then it allows for, when they do drink, less total drinks that they imbibe in. So in that sense, yes, it can be very good for people who want to cut down on drinking. What I would say is, it's always an experiment when you are talking to someone that wants to cut down but not completely quit, because it has to do with their genetics and their upbringing and really just their propensity to be addicted to that particular substance. So it's a good experiment, and the research does show that decreases binge drinking days, decreases the amount of drinks that you have, decreases time of abstinence. So yes, it can work. Where some people get into trouble, if you are on the other end of that spectrum and you really do have just what they call an addictive personality, where you just get addicted very, very quickly. It's very, very hard to let go of. You may find that using sometimes or drinking sometimes is just not for you. So it really depends. So there's some really, really cool research, both for alcohol use disorder and then also for heroin and cocaine. So let's start with the alcohol use disorder. So one of the trials was they did 3 sessions of ketamine a week plus therapy, or 3 sessions of ketamine without therapy, or saline with therapy, or saline without therapy. And what they found was the ketamine with therapy was the group that had the most efficacy. it resulted in 2.5 times more likely to get sober, 10 times less likely to die of alcohol use disorder, and then I believe it was 2% non-drinking days changed to 86% non-drinking days. So that's an incredibly powerful response. What we've seen is that ketamine is a really, really great treatment on its own. It's great for depression, it's great for anxiety, but if you're not capitalizing on that ability to make your brain change, then sometimes the effects can fade. Now, the research on alcohol use disorder and ketamine actually shows that up to 6 months, up to 12 months, it still has a very long-lasting effect without therapy. So I believe at 6 months it was something like 80% were sober, and then at a year it was something like 75% were sober. And just for reference, I think with standard treatment it was something like 20%. So that can have a very, very powerful effect. But if you combine it with therapy, essentially what you're doing is you're prolonging that effect, because you're taking those realizations that you have during ketamine, you're taking that spiritual experience and you're processing it, and you're talking about it, and you're making new habits, and you're talking about, okay, what do I do going forward? And all of that is taking that hyper-changeable state of your brain, and then it's ingraining those habits very, very quickly. So you can kind of think of it like, it'd be very hard to meditate while you're on ketamine because it is a psychedelic. But if you meditated once without the ketamine versus on the ketamine, it would be something like the equivalent of 50 meditation sessions, because you are so able to make those new neural pathways. One of the really, really cool studies was they gave a single ketamine session to heroin users, and without the session it was about 2% that got sober. With the session it was about 20% that got sober, and then with 3 sessions of ketamine it was 50%. So if you treat people with substance use disorders like I do, you look over the literature, that is unheard of with opiate addiction and with heroin addiction. It's basically something that cannot happen 50%. So that to me is really, really exciting. A quick note here, kind of off topic, but we'll get to it. There is sort of this attitude, I think, that people with addictions or with substance use disorders, they shouldn't really be taking any sort of psychotropic drug. To me, that's an idealist view, right? That's basically saying like, you have to have perfect 100% ideal sobriety or you're not really sober. And to me, that's kind of harmful, because if you can get somebody, let's say, who's drinking alcohol and they're able to get 6 months sobriety as opposed to 3 months sobriety, well, that's 3 months of their life that they were able to live, right? And if they're depressed, why would you make them go through a really bad depression on their own without these amazing tools that we can use? Why would you make them go through that just so that you can say that, okay, this person has the ideal sobriety that we think of? So to me, I like to use every tool in the toolkit, and we really should be looking at, okay, yes, there is the people that can get sober, they never take anything ever again, but what about people that need to be on methadone in order to not use? Well, it's not perfect, but it decreases their chance of dying. That's pretty good to me. And so using ketamine, even though it is a psychotropic medication, even though it is a psychedelic, I think we would be foolish not to use that tool, especially with the research that's come out on it. So Special K is a party drug. People use it in raves. It has, a dissociative effect. So yeah, you can abuse it. I think that most people, in fact, the large majority of people that are doing this in a clinical setting, they're not going to then go out and try and get the street version of ketamine, in part because it has anti-addictive properties. So you're just less likely to engage in impulsive and compulsive behaviors after you've taken the ketamine. But the people that we see are they really, really want to get better. And they're not the type of people that are inclined to then go abuse it. The other thing is that the type of, if you are the type of person that then goes and abuses it, you can probably find it a lot easier on the street than going and, going through a whole process with a doctor where you go through your whole medical history and then going through a whole therapy session and then using it and, probably paying more than you would for the street drug. I don't really see it. I follow up with my patients, and a lot of my ketamine patients either become patients or they were my patients already. And you can usually tell if someone's using, right? They're late to their appointments, they don't look well, they look sick, their relationships are suffering. I have yet to see a case where medical use led to street abuse. Yes. So the main one would be, are they actively using, right? So we like someone to be not going through withdrawal, hasn't taken any illicit substances within 2 days. If someone's a severe alcoholic, they might need to go through detox in order for that to happen. I would not suggest that. It's going to be probably not a fun experience because they're going to be withdrawing from it. Or, if they're actively on a substance, we don't want that interacting with the ketamine. I would also say people with severe health issues. So if you've had severe cardiac disease or liver or kidney disease, probably not the right medication for you. I would also say people that, there's what we call dual diagnosis. So that's, it can mean a lot of things, but the way we use it in psychiatry is schizophrenia plus alcohol use disorder or substance use disorder. So someone who has had a psychotic break or has a history of schizophrenia, you don't really want to be doing psychedelics. That's it's opening up the mind too much when the mind is already really too open if you're having a psychotic episode. So for those people, I would not recommend it. You wouldn't want someone who's having an active manic episode to be on ketamine, although from what I've seen, people who have bipolar that are stable, the chances of a manic conversion that's going from normal to having a manic episode, that's extremely rare on ketamine. And it doesn't happen more than placebo, is what I would say. That is a very fascinating and complex question. So I guess I'll answer it from a psychiatrist's view, a neurobiological view. So we have 3 types of memory. We have what's called working memory, short-term memory, and long-term memory. Working memory is basically what we're able to use in the moment. So like you memorize a phone number, that's working memory. And then it goes into your short-term memory, which is encoded in a little part of our brain called the hippocampus. It's deep, deep within our brain. There's 2 sides to it. It gets encoded there. And then when it turns to long-term memory, what's interesting is it kind of goes everywhere. It goes from your hippocampus to frontal lobe, the sides of your brain, the back part of your brain. It's really kind of encoded everywhere, and it's a complex process that takes a lot of different parts of your brain. To retrieve it, every time you retrieve a memory, it changes just a little bit. It's sort of like a game of telephone or putting something in a copier over and over and over again. By the time you get to the 100th copy, it's really just not the same paper, right? And that's why people can have situations where they're talking to somebody that they had a experience with, and it's 10 years later, and they have totally different memories of this experience. So when you're accessing a memory, you are also adding more context to it, right? So people tend to think a lot about situations in which they were awkward or situations that didn't go well. When you retrieve that memory, you're thinking about it, you're like, okay, this didn't go well, and why was that? And maybe it was because of this reason, and like, oh yeah, and then this person said this. And that contextualization changes it just a little bit. then it goes back into your hippocampus and then gets re-encoded as a long-term memory, sort of over the old long-term memory. This can cause a very interesting effect where because you're changing it every time, the memories just tend to evolve over time and turn into something different than the actual experience. So I've heard neurobiologists say that we have perfect memory. I don't buy it. I've never seen anything in psychiatry or neuroscience that implies that we're able to, like a machine, record something and then just have it be static. It's an active process. Yeah, that's a really great question. So there's another part of your brain called the nucleus accumbens that is responsible for pleasure and for really encoding what in life is valuable. So most people's nucleus accumbens, they'll have a very pleasurable moment. Let's say they drink. Their nucleus accumbens will release a lot of dopamine. They will get a lot of pleasure, but it won't really change anything about the way that they value the world. With people with addictions, what we found is that when their nucleus accumbens is fired by their drug of choice, it's actually changing the hierarchy of what they find valuable. So for most people, it'd be like, Maslow's hierarchy of needs, right? Oxygen, food, relationships, your goals, money, and you have a pretty static value hierarchy. For people that have an addiction, the alcohol or the drug just goes all the way to the top, right? Maybe not above breathing, right? They'd probably choose breathing above drinking, but it'd be a close session. It would be a close second. So the other thing is that because that dopamine release is so powerful in people that have addiction, it can make their memories sort of just forget all of the bad stuff that surrounded that. All they remember is the feeling of having that first drink. And that can be so powerful that it makes people ignore things you would never expect them to ignore, right? So people ignore their kids. There's these classic, very sad stories of like women leaving their children on the street to go get high. And people think of that in a moral way, like, oh, how could they do this? That's such a disgusting thing to do. To me, that's a sign that they have a brain disorder. No sane person would do that. And it's because that dopamine blast is it's completely clouding over any other memories of consequences that they have.
What are maladaptive reward memories?
So that's very similar to what we're talking about with the nucleus accumbens. Maladaptive reward memories are when your nucleus accumbens is triggered so much that the dopamine is covering over all of the consequences of what happened while they were high. So there's this thing in recovery that we teach people, which is called play the tape forward, right? So most people play the tape all the way up to the point where they get high and they're like, oh, if I do this and this and this, then I can get that reward. It's going to be fucking awesome. But they don't play the tape afterwards. And that is because that memory has been encoded in such a way where just everything else gets dropped. And you can think about it. So, a lot of people get addicted because they feel some kind of emotional or even physical pain. And if you were always in emotional pain and you finally find something that just makes you feel normal and makes you feel all right, well, are you going to remember the fact that you didn't show up to work? Or are you going to remember the fact that for the first time in your life you didn't feel pain? Probably the second one. But on a neurobiological level, it's encoding the reward. It is not encoding the consequence. And partly because, if you're high or drunk, you can't feel the consequence. And partly because nucleus accumbens, again, is just putting that dopamine blast on it's putting it way higher than anything else on your value hierarchy. So there's been some really, really interesting research on giving ketamine at the highest point of craving. And essentially what that's doing is, number one, it's increasing the excitatory ability of your brain. It's increasing a neurotransmitter called glutamate. So your brain is in a hyperexcitable state. It's increasing BDNF, which is a hormone that allows your brain to change. So it's increasing your brain's ability to change. And then it's also letting a lot more sensory information in when you're on the ketamine versus when you're not on the ketamine. So when you retrieve that memory, kind of like we were talking about, where doing one habit one time on ketamine is sort of like doing it 50 times not on ketamine. Well, that retrieval aspect where you're retrieving it, you're contextualizing it, you're changing it, and then you're putting it back, it's like doing that over and over 50 times in a row. And so the research that they've done is they will spike someone's craving, so they'll give them a smell of beer, and then right at the height of their craving, they'll give them a shot of IM ketamine, and then all those things that we just talked about will suddenly happen to the brain, or at least over the course of the next couple minutes. And then that memory is being retrieved, but you're contextualizing it, right? You're doing a lot of different things that are making the memory different. And specifically what you're doing is you're having the craving, but you're not acting on it. Then it's as if you're doing it 50, 60 times. You put it back. It's making that memory a lot more adaptive than it would have been previously. Well, we mess with people's memories all the time. It is dangerous messing with people's memories. I mean, I'll give you an example. So in the 90s, there was this scare where all of a sudden people started having what they called repressed memories, where they would suddenly remember their dad abusing them when they were very young, or they would remember being a part of a satanic ritual when they were 2 or 3 years old. Now, they started to catch on to this because there's not that many satanic rituals in the United States, and tens of thousands of people were having these memories. And what they found was these two psychologists had written a book about the danger of not processing repressed memories. The problem is, if you tell someone enough times, hey, remember when you were abused as a kid? Hey, remember when you were abused as a kid? They're gonna start, taking that memory, recontextualizing it, and being like, oh yeah, maybe I was. This was so powerful that they were able to convince parents that they abused their kids when they were younger, even though they initially did not remember it. It's sort of like a police interrogation. It's like, oh, well, you did this. It's like, I don't think I did that, but maybe. And then eventually, in the early 2000s, they found out this was kind of all nonsense, and that really we shouldn't be taking repressed memories. But so all of that to say, yes, there is an issue with, I think, with messing with memories in a gaslighting type way. But in terms of, retrieving somebody's memories about a craving, we're doing that all the time. Every time we remember something, we're changing it a little bit. So I wouldn't make this binary distinction between, doing recontextualizing a memory in therapy or with ketamine versus recontextualizing it on your own, because you're just kind of doing that all the time as it is. So ketamine creates that hyperexcitable state of the brain by releasing glutamate, which is a neurotransmitter. It's also increasing your brain's ability to change, and it's increasing the amount of sensory information that we take in. So we take in about 1% of all information that's coming at us. We do that for good reason, because it would be incredibly overwhelming, if not impossible, to take in 100% of the information that we see, right? So you can think of this as our fovea, which is the part of our eye that is very, very specific. It's only able to look at a couple of things in detail, and then everything on the periphery of your vision is all blurred. So if you were to take in that amount of information, it would be extremely overwhelming. But with ketamine, you're taking in just a little bit more. So when you're taking that first drink, or when you're smelling something like beer, you are able to take in that craving to a very, very extreme extent. When you then give the ketamine, or when you're already on the ketamine, your brain is then able to retrieve that memory, make the craving very, very powerful, and then contextualize that memory in maybe 50 to 100 times stronger than you would without the ketamine. And then it puts it back, and then because you didn't drink when you had that craving, you now have an adaptive memory of you having an extreme craving, very extreme craving, and then not drinking on it. So there's a couple different ways that you can take ketamine. One is orally, sublingually. You can take it as a shot, you can take it IV, you can do it intranasal. The two types of ketamine administration that are 100% bioavailable, which means that 100% of the ketamine is getting absorbed into your bloodstream, is intramuscular, which is a shot, and then IV, which is the needle in the tube in your arm. So intramuscular allows us to add the aspect of timing. When somebody is going through retraining their brain to be less maladaptive to cravings, we can have them sniff that beer or look at a picture of their drug of choice or whatever triggers them. We can have that trigger and then immediately give them the ketamine. So we're able to capitalize on them having a very, very intense experience and then immediately after feeling the ketamine and then having the ketamine affect their brain. Now you can theoretically do this with IV, it's just much more difficult because you would have to do an IV push basically right as it happens. Usually when we give ketamine IV, we've got a bag and it's dripping. Sometimes we'll have a little meter that allows it to drip a little bit faster, but they're getting it usually pretty gradually. With intranasal, with troches, which are sublingual, it's really not as, the timing isn't as exact as a shot. So if you put it under your tongue, you got to swish it around a little bit. It takes 20-30 minutes. If you swallow it, it's got to go through your stomach, through your liver, and then into your bloodstream. So you're really not capitalizing on that craving happening right then. So I would say it gives us the ability to capitalize on timing. The research shows that it lasts a pretty long time. So let's say for ketamine for depression, if you give someone a shot or IV ketamine when they're depressed, their depression will probably go away for about a month. You then have to redose them, which is fine. If they're healthy, that's probably fine. It's not ideal, but it's okay. With therapy, because we're using that ability to change the brain and to make habits quicker and to process things and to have more of a spiritual experience, they then take those realizations with them, and hopefully they take it with them forever, or they take it with them long enough and strong enough for it to last a very, very long time. So the studies that I've looked at, ketamine by itself, it's 3-4 weeks, something like that. Ketamine therapy, when they've done follow-ups a year later, majority of those patients are still not depressed. And that's just not the case with just standalone ketamine. So I like to combine it with therapy. You could theoretically combine it with something like meditation, just something that's growth oriented, but really ketamine therapy is the gold standard.
What about people that change their relationship with alcohol due to the ketamine treatments? Will that last?
So the research that we've seen with alcohol use and then with drug abuse, it doesn't last for everyone. So for instance, when they gave them ketamine therapy versus ketamine alone versus saline versus therapy alone, at the 6-month mark, it was about 75% of people were still not drinking. At the year mark, it was about 65, somewhere around there, that were not drinking. So that's 2/3. That's pretty damn good, especially for substance use disorders where, just for reference, opiate addiction has about a 5% recovery rate. That's 1 in 20. Like we talked about, a year later, if they've had 3 ketamine sessions, it's 50%, 10 times more. So that's really, really good. So we would need longitudinal studies to say, okay, what happens to this person 10 years later? They have done longitudinal studies on psilocybin. Particularly, there was one guy that had this was the only guy they followed longitudinally. He had one psilocybin experience, and then they followed up with him like 50 years later, he was still sober. So that's pretty amazing to me. And what that says to me is that these experiences, psychedelics, and I think psychedelic therapy can create long-lasting effects, as opposed to an antidepressant. You have to take it over and over again. Nothing wrong with that, but this might be a better intervention as opposed to an ongoing treatment. Yeah, therapist's role is extremely important. So they are, number one, guiding them through the ketamine experience. They are letting whatever comes up for the person. They're using they're a sounding board for them to talk about what is coming up, and then they're helping them recontextualize it. So a lot of people that get treated in ketamine therapy have trauma, right? Sometimes that trauma comes up and sometimes it doesn't. But with a therapist there, they're able to say like, okay, what if we contextualize it like this, right? What if maybe the world isn't an unsafe place? Maybe you went through a very hard experience and you're gonna come out on the other side stronger and better able to adapt to the world. It also helps having a therapist there to bring out what I would typify as like the spiritual part of ketamine. So a lot of people have these secular spiritual experiences when they're on ketamine. That's certainly possible when doing ketamine alone or doing it in a clinic. But with a therapist there that is used to amplifying those spiritual experiences, it's a lot more likely to happen. And then I would say for alcohol use disorder specifically, or substance use disorders, having somebody with experience treating those disorders, you are, again, it's almost as if you're doing 50 sessions in a row, right? Because the brain is just in that hyper-changeable state. So the therapist role is extremely powerful. They're almost like a shaman, I would say.
Is there a certain number of sessions that are recommended for a specific type of treatment, ketamine for alcohol use disorder?
Yeah, so I would say it's different for everyone. What I would say is what we've seen, if people don't do, let's say, 4 or more sessions, because every session is so different, because different things can come up in different sessions, it's hard to get a good sample size when it's less than 4. What we've seen is mostly around 6 to 8 for moderate to severe cases, maybe 4 if it's a case that is not so severe, but definitely not less than 4 in my experience. So I would say ketamine is a very specific type of psychedelic. So you have what we term as hallucinogens, that's LSD and psilocybin. Those give you visual hallucinations or patterns that you see on the wall. The world can look a lot more beautiful. It's a lot more externally focused. Ketamine is a dissociative. You feel outside of yourself, and that gives you what I would term ego disillusion, right? So instead of thinking about, sort of the little me, the me that gets hurt and has done embarrassing things in the past and has to plan for the future, you're able to zoom out a little bit, get a more objective view, and not be so attached to your own ego. It also can be very, I would say, it's a very different visual experience. So instead of seeing patterns on the wall or hallucinations, people are more seeing, like, I would say, a granular view of the world. Like, the world might look a little bit black and white. They might notice small little details that they might not have otherwise, but it's not this like, oh my God, things are turning different colors and I'm seeing all sorts of characters on the wall. So in terms of its like efficacy, they're similar, certainly, but because of that unique dissociative effect, you're gonna have more of a melting away of the ego, as opposed to the external world suddenly looks different to me. So I would say that you're a good fit for this treatment if you suffer from anxiety, depression, substance use disorders, if you're able to, get to a point where you're not actively using and you're not going through withdrawal. So sometimes that takes detox. Traumatized patient, I would say that you need to be generally healthy. So can't have people that have a history of stroke, kidney, liver disease, glaucoma. You should talk to your doctor, obviously, before doing any medical treatment. And then people that want to have existential experiences. So, there's other treatments that are good for depression, but I think ketamine is unique because it's a very existential, spiritual experience for people to go through. I would also say that it's very good for people that feel stuck. So we sort of think of ketamine as like a tow truck. It gets you out of the ditch, it gets you down the road, and then it propels you forward. But yeah, I would say it's good for those people maybe that are going through life transitions, or they feel like they've tried everything, they're stuck, they need to get out of that hole.
What are the risks?
So the risks, I would say, number one, ketamine can increase your blood pressure temporarily. It's about as much as going on a really hard run. However, if you have a history of cardiac disease, maybe you don't want that increase in blood pressure, or if you have blood pressure already, also if you're generally unhealthy, or you've had a stroke, you have cardiac disease, you've had liver, kidney disease, it's probably not the best for you. In terms of like psychological aspects that are probably not good for ketamine, definitely if you've had a psychotic episode, this is probably not right for you, because it's putting your brain in sort of more of a disorganized state, and people with schizophrenia, their brain is already kind of disorganized. OCD, it can work pretty well for the anxiety aspects of OCD, and it's definitely not a contraindication, but the research on using ketamine specifically for OCD, it's kind of meh. And then I would say anyone who's like so severe that they can't get even a couple of hours sober, you need to go to a detox before you try any treatment. So whether that be rehab or ketamine therapy, you need to have a couple of days where you're sober, make sure you're not going through a dangerous withdrawal, and then try ketamine therapy. So the main ones are naltrexone, acamprosate, and disulfiram. So naltrexone is an opiate blocker. It blocks your opiate receptors in your body. And what they found is that calms down your nucleus accumbens a little bit. Acamprosate, that increases GABA, which is the relaxing neurotransmitter in your brain. So it kind of simulates alcohol. So that tends to increase time to abstinence. Those are good medications, and I use those quite a bit. The issue with those is that we just haven't really found any medications that have like gangbusters efficacy, right? So maybe 30-40% of people will have success on those medications. Disulfiram, also known as antabuse, that basically makes you really, really nauseous if you were to drink. So like if I've taken my disulfiram today, I can't really drink for a week, otherwise it's just going to be a miserable experience. I'm going to be throwing up the whole time. That's not as good as naltrexone and acamprosate. So there's definitely medications out there. I would say that they're definitely not as powerful in terms of efficacy as something like ketamine therapy. Yes, it is safe to use ketamine while using any of those other medications. You don't want to be on a super high dose of benzos. That's not really for a safety reason, but more because it just decreases the efficacy. They also found that Lamictal, people that are on Lamictal, tends to decrease the efficacy a little bit. What I've seen in practice is people that are on benzos or Lamictal, they still get a pretty good, a pretty powerful effect from it. It's just not as good, right? It's not the ideal, but it is safe to use those medications.